Hello, I'm Rebecca Haddad. I would like to thank the ICS Scientific Committee for allowing us to present our study on detrusor contractility in postmenopausal women and its association with aging. I have nothing to disclose. So you must know that detrusor contractility assessment is an essential part of urogynecology management of patients with LUTS, and the methods for assessing detrusor contractility are still under discussion, in particular because of the very definition of contractility, which is not consensual. Evaluation of detrusor contractility in women remains discussed because attempts to define the contractility index have been primarily conducted in male population, and recent evidence have shown that the detrusor contractility indices like PIP-1 and K parameter from VBN mathematical model produce comparable and consistent results, while the PIP-DECO-BCI led to inconsistencies. The objective of our study was to determine if detrusor contractility assessed by PIP-1 and parameter K was associated with age or main complaint or urodynamic diagnosis in a large population of postmenopausal women referred for evaluation of LUTS. So all women over 65 years old without diabetes or neurological pathology referred for the assessment of LUTS in our department, and patients who had UDS with PFS were included. Data recorded was the urodynamic diagnosis, which was classified as detrusor overactivity, detrusor underactivity, the association between detrusor overactivity and detrusor underactivity, which was previously known as DHIC, and bladder outlet obstruction. PIP-1 and K contractility indices, age and main complaint, were also recorded. The associations between PIP-1, RK, and age, main complaint, and urodynamic diagnosis were assessed in univariate analysis. A total of 190 patients were included with a mean age of 74 years old. The most frequent complaint was mixed urinary incontinence, which was reported by more than 30% of the patients, followed by urinary incontinence, other complaints, and the less frequent complaint was stress urinary incontinence. Urodynamic diagnosis, the most frequent was DO or DU in 19% of the patients, followed by normal urodynamic diagnosis, bladder outlet obstruction, and DO-DU in 7% of the participants. There was no significant association between PIP-1 or K parameter and age. There was a significant association between PIP-1 or K and main complaint, and these two indices were higher in patients with urinary incontinence, and there was a significant association between urodynamic diagnosis, as you can see here, and regardless of age. In conclusion, PIP-1 and K parameter are two indices allowing an easy evaluation of detrusor contractility. The decrease of bladder function is a significant characteristic of a population of older women, but there is no significant evolution of the value of indices for detrusor contractility with aging in postmenopausal women, whatever the complaint of the urodynamic diagnosis was. None of these indices as predominant, and both can be used for evaluation of detrusor contractility. And I would like to dedicate this work and this presentation in loving memory of Pierre Nelson, who passed away recently. Thank you very much.